to these issues that are being raised. Thank you, Honorable.
Very well. Chair, you have another response on a similar matter, so we will not spend so much time on this. The response to Honorable Joyce Kamene.
Once again, thank you, Honorable Speaker. This is in response to Honorable Joyce Kamene regarding blood donation and transfusion services at Kenyatta National Hospital. They are very close but separate. The first one was the shortage of blood transfusion kits nationally. This is the issue of blood transfusion service at Kenyatta National Hospital. In a way, they are related. So the issues that the Honorable Member raised were measures the Ministry of Health has in place to ensure seamless services to patients requiring critical blood transfusion services, especially platelets, donation and transfusion, given that the center does not operate during weekends and past the scheduled hours. The response is the ministry has established a robust national blood services network to ensure an efficient and effective blood transfusion services. The network comprises of 6 regional blood transfusion centers that act as hubs, namely in Nairobi for Nairobi region, Nakuru for Central Rift region, Eldoret for North Rift region, Kisumu for Lake Basin, Embu and Mount Kenya region, and Mombasa for Coastal region. Each regional blood transfusion center serves between 7 and 10 counties. 45 blood satellite centers or spokes are strategically distributed across the country to ensure equitable access to safe and adequate blood and blood products. And the blood transfusion centers serve as the backbone of the National Blood Services Network, bearing the responsibility for processing, conducting specialized laboratory testing for transfusion, transmissible infections. In addition, they handle storage, distribution, and coordination of blood donor recruitment and collection activities, ensuring a reliable and efficient blood supply system across the respective regions. And I have a list giving the other 45 regional collection centers, apart from the ones I've mentioned. To complementing the hubs are the satellite centers whose primary role is to mobilize donors, collect, process, store, and distribute blood to all transfusion health facilities within their jurisdiction. Together, the hubs and spokes form an integrated network that ensures the availability of safe and adequate blood transfusion across all levels. The Ministry of Health hosts the Nairobi Regional Transfusion Center within the Ministry of Health Hafia Annex Compound, a facility that is distinct from the Kenyatta National Hospital Blood Satellite Center located within the hospital. Although separate, the two centers perform complementary functions that collectively enhance the efficiency and the responsiveness of blood transfusion services in the region. The two-tier support structure ensures seamless coordination, rapid response, and timely access to safe blood for critical patients within Kenyatta National Hospital and the surrounding health facilities. The Kenyatta National Hospital Blood Satellite Center was established to meet the hospital's high demand for blood and blood components, which arises from the specialized surgeries, emergencies, critical care, maternity, and oncology interventions. The facility is fully equipped to prepare all blood components, including platelets that the Honorable Member asked for, plasma and red cell concentrates, and operates on a 24-hour basis, ensuring uninterrupted service delivery to the patients in need. Two, the Honorable Member needed to know the steps being taken to extend the operating hours beyond 5 p.m. and weekends so as to receive more blood donations. The Ministry of Health recognizes the growing demand for blood and blood components, particularly in urban referral settings, and is therefore taking proactive measures to enhance operational hours and strengthen service delivery. Currently, all satellite blood bank centers, including Kenyatta National Hospital satellite, operate on a 24-hour basis, including weekends and public holidays. Similarly, the regional blood transfusion centers operate daily and respond to emergency call out at night and other hours, ensuring the timely availability of blood for patients in need. However, staffing gaps, especially among technical laboratory officers responsible for blood transfusion testing and components preparation, continue to pose a challenge in extending full routine services on hours beyond 5 p.m. In response, the ministry has implemented several mitigation measures to address these capacity constraints. One, they have initiated a progressive staff deployment plan to strengthen the technical capacity at regional blood transfusion centers while engaging county governments through the existing governmental avenues to strengthen the operation of satellite blood centers and blood banks. Two, the ministry through the Kenya Blood, Tissue and Transplant Services has introduced flexible working shifts and workflow systems to cover extended hours and emergencies. Three, the Kenya Blood Transfusion and Transplant Services has an approved staff establishment of 275 for the 6 regional blood transfusion centers but in post, but staff are only, they have an establishment of 275, but staff in post are only 135, which is 49% of their requirement. In this regard, we have engaged Public Service Commission and have agreed to conduct a work staff load analysis for purposes of finalizing the Kenya Blood Transfusion and Transplant organogram to pave way for engaging more staff optimized operations. This is earmarked to be undertaken by December 2025. We are there. In regard to platelet availability, the ministry has enough capacity at the Nairobi Regional Blood Transfusion Center to prepare, store, distribute complements, including platelets. This has been made possible through the procurement of a newly installed automated equipment in addition to anapheresis at the Regional Blood Transfusion Center. In addition, the ministry continues to collaborate with partners and volunteers to support weekend blood drives and after-hours donor recruitment campaigns, ensuring sustained donor engagement and continuous replenishment of blood stocks. These combined efforts are geared towards ensuring consistent blood availability, expanded donor access beyond traditional working hours, and improved service delivery across all levels of the health system. Furthermore, transfusing health facilities and satellite blood centers are expected to collaborate closely with the regional blood transfusion centers to maintain adequate stocks of screened, ready-to-use blood in their storage. This stock should cater not only to routine transfusion needs, but also to weekend and holiday demands. Notably, this function is largely a service delivery responsibility and therefore falls under the mandate of county governments. The third inquiry was a comprehensive report on the status of apheresis machines at Kenyatta National Hospital, including plans, if any, to procure another machine to supplement the existing one. Response: an apheresis machine directly collects blood concentrate from a donor. Platelets can be prepared from whole blood using automated centrifuge or by manual methods. The apheresis machine at Kenyatta, at the National Regional Blood Transfusion Center, is newly installed, fully functional, and covered by a comprehensive maintenance contract with the manufacturer. As a result, any technical issues are addressed promptly. Madam Speaker, what they're really saying in that statement is, apart from the new machine, they are also doing it manually using centrifuge systems. I think that's what that means. The installation has significantly increased the center's capacity to produce platelets and plasma components for patients who require specialist transfusion support. Consequently, we no longer face the blood component preparation challenges previously experienced. In addition, as part of the ongoing modernization of blood services, the Ministry of Health has ordered an additional apheresis machine scheduled for delivery by the end of 2025. The satellite has also the capacity to prepare platelets, further strengthening national readiness to meet patient needs. Query number 4 was plans put in place by the Ministry of Health to upscale the capacity of the blood transfusion services at Kenyatta National Hospital to address the huge influx of patients, given that it is a referral hospital. The Ministry of Health has prioritized the Nairobi Regional Blood Transfusion Center for infrastructure and capacity enhancement to meet the increasing donor turnout and transfusion demand within the capacity of the city. Ongoing and planned interventions include expansion of the and refurbishment of the donor areas and the laboratory, procurement of additional processing and testing equipment, strengthening donor mobilization initiatives, deployment of additional technical and donor recruitment staff to manage extended hours and high volume operations. And lastly,
Honorable Chair,
lastly, in integration of the Nairobi, integration of the Nairobi Regional Blood Transfusion Center and Kenyatta National Hospital satellite into the National Blood Service Sustainability and Digital Management Framework for efficient resource tracking and inventory management. Thank you, Madam Speaker. In my comment is that is different from what we discussed earlier, is basically staff. The other time we were talking largely of the budget. What this has introduced is a staff shortage. So I think as a committee, I know other members will respond, my response would be, what are we going to do about the staff complaint for the National Blood Transfusion Services? I think, thank you, Honorable Speaker.
Very much, Chair. Honorable Kamene, member for Machakos, do you have any clarifications to seek?
Thank you, Madam Speaker, and thank you, Chair, for the feedback. But I still feel, and I still think that some of those answers are not valid, because he has stated very clearly that the satellite banks have been revived. And I wonder, how will these satellite banks work when the counties do not even have a capacity to test? The other issue is on the 24-hour operation, which I think, and which I know is not true. What I would request is if the committee would make a visit to these centers, and especially the Kenyatta National, to see one-on-one what is being stated and what is actually taking place in the transfusion centers. Thank you, Madam Speaker.
Chair, would you like to make any comment on that?
Thank you, Madam Chair. Yes, I do agree. The truth is, when we ask these questions and the ministers give us, or the ministers or the PSS give us answers, they literally depend on the technical report they get from the officers. And obviously, they will try to make them look as good as possible when they're coming before us. I therefore agree with the honorable member that the best way to look at this is actually to visit not only Kenyatta, but even the regional satellite banks. They are really supposed to work, from my own knowledge, that actually every county hospital should be able to do transfusions, and then they serve also at the regional satellites. Ideally, like hospitals, they should work around the clock or have call services for hours after 5 p.m. So I do agree, and as a committee, we actually need to visit these county facilities, because even with our SHA operations, That is something we need to look at. And they are under the counties. So the information we get from the Ministry of Health need to be actually corroborated by what we get when we get to the ground, which then is actually the responsibilities of the governors. And therefore, probably, you may not then hold the ministry very much accountable for. Thank you, Honorable Speaker.
Well, two issues. One is that you have said the technocrats try as much as possible to make the response look better than it is, which is a very serious concern. And the Honorable Kamene has asked that you make a visit. I would like you to be specific on when the Health Committee is going to make this visit. And specifically, she's requesting the one for Kenyatta National Hospital. So when can you do that? Do you have an indication of time?
Pending on looking at our program, I think that's something we should be able to do before we go into recess. I think it can't be very specific until I go and look at our program, but we would want to do it before we go into recess.
Okay, Honorable Kamene, fair enough, before we go for recess. Thank you.
Madam Speaker.
Thank you very much. The Honorable Rahim? Do you have a response to a statement?
Yes, Madam Speaker.
You may proceed.
Thank you, Madam Speaker. Madam Speaker, the first response is for Honorable Bernard Kitur, Member of Parliament for Nandi Hills. Madam Speaker, the committee received a response from the Ministry of Roads and Transport through the Clerk of the National Assembly, which I wish to make, regarding plans by the Kenya Rural Roads KERA to install properly designed and clearly marked speed bumps, erect proper signage and additional safety intervention, such as reflective road lighting to reduce the risk of accidents along the road. The Cabinet Secretary for Roads and Transport submitted that the ministry, through KERA, has